So maybe let me step in.
Yes,
and
yes.
maybe let me wear my advisor hat.
Yes, please.
The people that are here look to us for direction
For that,
and clarity.
when you're done, we need a Mentimeter. Everyone must say super clear.
So the audience that's joining us today, online and in person, probably some of the corporate entities and businesses of South Africa. And like ASI, they take care of a workforce of employees. And they may be partnership with ASI through any one of the employee benefit suites. And we know that there's lots of pots and pans happening in the retirement fund section. There's a whole lot happening now in healthcare. The employer is stuck kind of in the middle, and you're constantly dealing with your employee, right? You are looking for cost-effective solutions, things that keep your employee satisfied, and you've got to wonder, where does that come from, right? So the problem we're trying to solve for the audience that's here today and online is they've got to retain these employees. They've got to attract talent into their workforce because that's who drives their business. Traditionally, we've done this from our parents and grandparents' day. It was such an elite benefit when you heard that they qualified for medical scheme through the employer. Again, a condition of employment for you to join is to be part of that employer. You can join this medical scheme. Back then, if we go, we had good public healthcare sector and private healthcare working together. And yes, we must acknowledge the public healthcare sector has deteriorated over the years, and that fear that it has created has actually propelled the private healthcare sector, because we're too scared to move back there, right? We're also too scared to take a chance with the public healthcare sector. And I think what you've heard from our panel today is that they're trying to rectify many, many years of things that have fallen apart and deteriorated by bringing in national health insurance. It is the future. And you've got to consider, I think, as an employer, where is your employee right now in their life stage? And I'll give you some solutions or some ideas. We sit daily with your workforce, with your employees, telling us, my employer has given me all of these wonderful benefits. I'm enjoying private healthcare. But Naseema, I don't have money to put food on the table, okay? For the last 5 years, we've seen our Council for Medical Scheme report that our members are strategically removing their dependents. Primary reason, they cannot afford that combined premium anymore to keep their dependents on. So I've got to stay on, it's a condition of my employment, but I'm slowly taking off the dependents that I'm supposed to care of because I cannot afford that anymore. So we can't just say the public healthcare sector is broken. The private sector is also equally broken, all right? We can't be continuing paying the premiums that we're paying. You go to hospital today, right? And if you don't understand your plan, if you don't understand your network, you don't understand your benefits, you get treated and you get sent home, you have your procedures done. But a few weeks later, you suddenly have bills and you thought, but I thought my medical scheme covered me in full. No, it's because you didn't take out gap cover. Why do I need gap cover if I'm paying that premium for the current medical scheme that I have? So the working force that you have right now in your care is looking to us and you to provide them with the certainty. And we're saying, if you're looking to the future, why not? We know NHI is going to generate some cost saving into the system. Why not don't we resculpture our employee benefit strategies, our policies to say, we will have NHI, we will have all of this complementary cover that we currently enjoy within the rules and regulations of the Act, but how do we structure that so that we bring down cost effectiveness and at the same time generate value for you to keep those employees in the system and attract the future ones that are coming. Now your pensioners who are exiting the system, they work for 40, 50 years of their life. When they leave, what happens to them? Most of our pensioners cannot afford to stay on private healthcare, and they're like, it's okay, I'll take a chance with public sector. Those who tried for a couple of years realize it's eating away at their pension, so then they drop off later. Your current working force, taking off their dependents to make it sustainable for them financially, they land up in hospital, things are not paid in full, and they get into more financial debt because they now have to pay back doctors for things that have not been paid by the medical scheme. And then I must tell you, there's this amazing bunch of people joining the workforce right now, which I always call the future employees. And they arrive here all bright and bubbly, ready and energetic because they have their first corporate position.
Of course.
They sit with HR, and a lot of you come from human capital and HR. You take them through their pay slip. and you show them all of the deductions, and they go, yo,
Yes.
do I have to belong to this particular medical scheme? It's a question that we're getting. The new generation is not reluctant to joining NHI because they want to see that they actually take home more money. And a lot of them then tell us, it's okay, I'll stay on my parents' Medicare because I can't afford that particular deduction. So I'm saying, as corporate South Africa, we need to be part of the solution. We have a number of solutions available to our clients. Some we're experimenting with right now. But I think maybe just to give a high-level situation that we're dealing with right now, a lot of our employers are saying, I'm going to kind of see what Professor Crisp does, and then I'll decide. And you need to realize that indecisiveness is the biggest thief of opportunity. There is a lot of opportunity. NHI has actually been the most exciting time for ASI because we feel it's the defibrillator we needed in the healthcare sector for many, many years. There's so much of conversation and activity, and now we start setting the scales correctly between public and private sector. But the second solution you have right now, we are your advisors. Many of you have consulted with us personally, and you've experienced how we've helped you financially, but you're still within the same private sector. Yes? So we're saying you don't have to leave right now. You have to think about the future and adopt what's coming and be open to what's coming, and we restructured that. But right now, there are financial solutions that can help you within the private sector that you don't have to pay as much as you're paying. It's just that nobody comes for those consultations. You review your cell phone every year. You review your car insurance every year. Why don't you review your medical scheme options every year? They're changing. Benefits are eroding. Restrictions are being placed. But we don't think about that. So it's the employer sitting in this room today's duty and responsibility, like me as an employer, to ensure that our employees go through these conversations with advisors, because we are the people who have to know the product. We have to ask you what your financial needs. Can you afford? Can't you afford? We have to ask you what your healthcare needs are so that we can find you the right solution so that you're not spending a third of your salary on one particular benefit. You actually have money to live a good quality of life. That's an important aspect of the dialogue that you've got to take with us. But being ASI, we also do things a lot differently. And we're also focusing on the future employees and what they actually value. They don't value traditional benefits the same way we do. They want flexibility. They want access to care, but they also want it at very compelling prices. They are willing to challenge what we currently have in our employee benefit suites. So to employers right now, we've done a lot of research, and we've looked at things that actually the future employees value. Healthcare does form one of the pillars. They do want access to good healthcare, but they're open to public and private sector collaboration. However, we've identified that there are 7 key pillars of reward that the future employee is actually looking for. And they all tie back to financial as well. And we're saying we want to look at the brave employers who are willing to walk this journey with us and say, we're going to use NHI as our foundation. We're going to work with our healthcare sector and our medical schemes because it is an important pillar of reward for employees. But at the same time, how do we reconstruct our employee value proposition to ensure we're still taking care of those exiting the system with the traditional benefits, but we are evolving so that we have this future workforce that's coming in and we can actually cater for the value and the needs that they have in comparison to what we all think should stay and should not change. But you need to have these dialogues and conversations with us because we're saying we will work with what we have. We will make it work. But our responsibility is to make sure we do it in a financially responsible and sustainable model for each and every one of your employees.
Oh, wow. I think that's the best place to clap.